Are you preparing for a nursing interview?
Yes!
Let's go through some potential questions and answers. Let's get into it. Hey, welcome back to my channel. If you're new here, my name is Christina. I am a bedside registered nurse. I am a working family nurse practitioner and a mama of two. This channel is geared to help make nursing easier on you. I'm sharing tips, strategies, and educational content. So if that sounds like something you're into, do me a favor and hit the subscribe button below. So I'm gonna do a mock interview and answer 7 top questions that you may encounter. As a disclaimer, the first question, like 90% of the time, always begins with, tell me about yourself. This question is usually the icebreaker to help get the interviewer more comfortable, and this question is not meant to share your life story, but to frame it around your career and how you got there, so highlight the specifics and be brief.
Why did you choose nursing as a career?
I chose nursing because as a young girl, I lost my grandpa from a heart attack. He was a huge role model in my life, and witnessing firsthand was the scariest thing I ever experienced. This life event was my driving force of why I chose nursing and to be able to help others and do it over and over again. This is one of many reasons why I chose nursing as a career.
What would you consider rewarding about this job you applied for?
Personally, for me, the reward comes with the hard work that is driven by the patient care I provide. My 3 driving forces would be compassion, accountability, and teamwork. Compassion would be going the extra mile and bringing your patient a warm blanket and spending that extra 5 minutes one-on-one and listening to them. The reward comes from owning your own accountability and knowing your scope of practice to provide safe patient care. Last would be teamwork and collaboration in helping other colleagues that need your assistance.
How do you deal with conflict? Let's say one of your patients is upset with you. How would you approach it?
Well, let me paint the picture for you. Of a past experience of mine, I got a report from one of the off-going nurses and was told the patient I was receiving was very anxious and refused all treatments and on his call bell like every 5 minutes. So as the receiving nurse, I assessed the situation. He's clearly upset and angry. There is a language barrier and lack of knowledge. So my diagnosis is anxiety because of miscommunication and lack of knowledge. My plan would be to collaborate with the team and have a meeting that includes his primary family and the patient to help decide on a plan of care with the doctors. My interventions would be to use a translator and give updates to the patient and request the care partner to do more frequent checks for continuity of care. Through evaluation, my patient was less anxious because he understood and agreed on the plan of care. But let's say the patient was still upset. I would go back to the nursing process and reevaluate my plan of care with the patient and also include the charge nurse as well.
Now, how do you handle stress on the job?
I prioritize my care based on patient acuity. I always have to stay organized, and what helps me stay organized is I use a nursing report sheet and plan out my shift at the beginning and make updates as things change. This helps decrease my workload and ease my stress to make my shifts a lot easier. I have also learned to delegate to care partners when I need help and if it's within their scope of practice. I've learned through time that it takes a village to get patient care done, so when I need help, I ask. It's not often, but in exchange, I also help others because it helps build the reciprocal relationship.
What would you find the hardest part of being a nurse?
I would say the hardest part of being a nurse is all of the charting that comes with patient care. I understand if you didn't chart, it didn't happen, but I feel the charting takes me away from patient care and could be time spent with the patient. So that challenge has been a tough transition. However, what I have done in the past is get more training on charting to help me streamline my care as a nurse. This has helped teach me how to create smart phrases and templates to help with discharges and end of shift notes. Since I have learned this, I have been able to decrease my charting time and in turn spend at the bedside with the patient. Likewise, if hired, I would want to make that investment with learning the charting system used here to help guide my care.
Now, tell me a mistake you've made and how did you approach it?
A mistake I've made early on in my career was underfilling one of my lab specimens for my PTT. I didn't know that the lab specimen was precise with filling the amount of blood at the tube level required. This caused a delay in my results, and my patient had to be stuck twice with the needle. It also delayed time with titrating my heparin drip. Thankfully, after the specimen was collected and resulted, my patient's PTT was therapeutic, so no change was required for me to titrate the heparin drip. Since that was a learning curve for me, I always make it a conscious effort to fill each lab specimen to its desired level.
Why are you the best candidate for this nursing position?
Nursing is more than a career. It's my passion. I enjoy caring for others at their most vulnerable time and shining some light through my patient that may be filled with fear and anxiety. My goal as a nurse are to strive in exceeding in patient care every shift, every time by going that extra mile. I'm starting off as a staff nurse, but have so much desire and motivation to learn as much as I can and grow within the company if chosen as a potential candidate. I believe I will excel if given the opportunity to be a part of the team because I lead with passion and knowledge. So look, we just went over 7 top nursing interview questions, but this leads me on what to expect in your first year as a registered nurse. You definitely got to check it out. Be sure to click on the link and I'll see you in the next one. Take care.